Given Manitoba's numbers, few expected schools in Winnipeg could actually reopen next week. Doesn't mean they weren't hoping.
You would like to send them back to school? Yeah, but then the vaccines and stuff.
Arius McKay, like many, now wondering with the case numbers if reopening sometime in June is even worth it.
I'm not too sure if I'm going to be sending my kids back to school, actually.
So these new public health orders will take effect Saturday.
Schools, just part of yet another extension of health orders that have banned gatherings, limited retail, and now enable the province to rapidly shut down businesses with outbreaks.
Manitobans must stay home.
Even the Premier admits it's a tired message, but he's sticking with it, asking businesses to move to remote work while resisting calls for a lockdown.
There's another factor. That's the willingness of people to follow the rules. That's a key determinant in the model that public health uses.
Effectiveness of Manitoba's ever-tightening rules is still an open question. Cases are down, but ICUs keep filling up. In fact, patient demand caused this hospital to use a secondary oxygen supply. Manageable, but a show of strain. Airlifts to other provinces continue. 25 ICU patients have gone to Ontario. Saskatchewan will take 5. The province is looking into the death of one whose condition deteriorated just before transport.
One of the things that we've definitely learned about COVID is it's unpredictable, and people can change course reasonably suddenly.
Meanwhile, vaccinations are slowing. 63% of adults have at least one shot, but now appointments open to anyone are going unused.
The more vaccine uptake we get, the more we're going to protect Manitobans, the sooner we're going to start being able to look at lifting these restrictions.
So, Cam, I'm curious about the vaccines. What is causing the stall?
Well, it seems right now in Manitoba, we've reached that point where everyone that wanted a vaccine either has an appointment or has had a first shot already. So the province is running up against some hesitancy. It's going to try some culturally sensitive messaging in some racialized and BIPOC Indigenous communities where there is some hesitancy. Also, the Premier says that they are going to try to incentivize vaccines with an opening plan, as distant as opening does feel right now in this province, Adrienne.
I bet. Cam McIntosh in Winnipeg. Thank you, Cam.